The next public hospital will be built in the northern region after 2020. Health Minister Gan Kim-yong says his ministry is studying sites in several areas, with Woodlands being one of them. Mr. Gan was speaking on the sidelines of the groundbreaking ceremony for a new integrated hospital in Sengkang.
By 2018, this site will house one of Singapore's largest regional hospitals. Sengkang General and Community Hospitals is part of the Health Ministry's master plan, which aims to add more than 4,000 hospital beds by 2020. In addition to the existing acute hospitals, the government plans to build 4 new acute hospitals between 2020 and 2030. The Health Ministry is studying the exact location with land agencies and says Woodlands is a possible site.
To also take into account the demographic pattern and beyond 2020 is still some time to go. So we will decide on the specific location nearer the time so as to take into account changes in the demographics over the next few years. We also need to look at the pattern of the diseases and what would be more relevant, more important, and therefore it's important for us to remain flexible.
Mr. Gan added that it's also important for hospitals to be flexible to meet future healthcare needs. The new integrated 1,400-bedded hospital hopes to achieve this with its swing beds.
The hospital is planned to have 800 acute hospital beds, just like any general hospital, and 400 community hospital for rehabilitation and transitional care. But we also have 200 additional beds that are planned and designed that can be used either way. So if the hospital requires more acute beds, we can have 1,000, that means 800 plus 200. Or if the hospital requires more community hospital step-down bed, then we can have 400 plus 200.
And if need be, the hospital can temporarily accommodate up to 1,600 beds in times of crisis, such as an outbreak. There will also be an open hub in the hospital which will host wellness-related activities, such as health screening and exhibitions.
With Sengkang being a fairly new town, its demographics comprise young families and children. Now, the new hospital is considering working with partners such as GPs and polyclinics to provide community-based pediatrics.
Sengkang General and Community Hospitals will be opened in phases, starting with the acute hospital.